Here we are. It's a great day to talk chest. We're going to do chest, and how come they always come with buys? I don't know, but there is a relationship. Today, we're going to continue our discussion of Muscle of the Month, the pectoralis group. What do we want to talk about? Common injuries. And is it your pec or is it something else, okay? And you're going to have generally two types of injuries to the pectoral, the chest muscles. Acute type injuries, where you did something and you felt it right away, okay? You were pushing on something and you felt it pull. Your arm got pulled back, it got stretched, and you felt it pull. Lifting, some sort of playing sports and it was a fall. Sudden onset, you're gonna feel the pain. It's going to be sharp, it's going to be lancinating, it's going to be very difficult to elevate the arm, to do any sort of pushing type motions. It's going to be sensitive to stretch, okay? The other issue is chronic problems, where it slowly gets irritated, and you find when you bench, oh gosh, my chest, my shoulder really hurts. You find when you do repetitive movements around the house, working on things, it hurts. Playing some pickup touch ball, football with the guys or your friends, and you find, oh, it's starting to hurt because you're pushing people around. That's a low-grade injury, more of a chronic strain, or what we call a tendinosis, where the tendon actually frays from the inside out. So you need to have an accurate diagnosis. Some things you also need to think about. Chest pain could be underneath the pectoral, could be the ribs, could be your lungs. If it's on the left, it could be your heart. So there's other things that can give you chest pain too, all right? But let's back it up a little bit, and assuming that you've already evaluated and it's not an organ, it's the pectoral group, what other muscles in the area? Well, guess what? Your infraspinatus in the back here, we talked about that in the shoulder series, refers pain to the front of the shoulder. What about your bicep? Comes up and goes and attaches up into the shoulder, comes along the front. It also goes right by where the pectoral muscle attaches. So biceps tendinitis can also mimic a shoulder or a pec injury, all right? And sometimes it's just the clavicle here, and the clavicle attaches to your breastbone in the middle and your shoulder bone out here, your wing bone, and that's got to be fully functional. If that's not moving right, if it's tight or stiff, it can give you chest pain as well. So those are the differential diagnoses of what's going on. The muscle can be tight and shortened and stiff, and it could be tight and weak, or it could just be sore. Another caveat is if you're getting pain with movement, it doesn't necessarily mean it's the chest. Again, the scapular stabilizer muscles hold the whole shoulder girdle into place. So if you're doing a chest workout and you're getting pain in the chest, it could be abnormal or scapular kinematics. Go watch the video on the shoulder, okay, on getting the wing bone in the right place. So there are some tips on how to differentiate what's causing your pectoral pain, and if it is the pec pain, follow-up videos are going to be talking about treatment of those pectoral injuries. It's a great day to talk rehab. I'm Dr. DeFabio. Thanks for tuning in.